his aorta valve was very bad and that he needed surgery, or the prognosis was not good. He was a very active person. Then he started having some lung problems where he needed oxygen to breathe, and then he had some heart issues, heart problems.
It was 17 years he's had that bypass. And then he just passed out on us.
When he arrived here from Upper Valley Medical Center, we were asked to see him about his cardiac status. Why did he pass out?
And it was just very scary, wondering, what was going to happen.
Once we talked with Mr. Hirsch and the family about what went on, then we examined the patient and listened to the heart and the lungs, the neck arteries, and the abdomen to see if there's any clues of what could be going on. And on Mr. Hirsch's case, it was a big clue. He had a loud heart murmur, or a sound when we listened with our stethoscope on his heart, and we heard a loud rushing sound. That clued us off that he had some significant valve heart disease, specifically of his aortic valve.
Aortic stenosis is a problem with the valve that leads out of the heart.
Aortic stenosis is frequently a disease of folks in their 7th and 8th decade. And with lengthening survival, as we're seeing more and more folks make it into their 7th and 8th decades, we're going to see more and more of this particular disease.
Severe aortic stenosis, which we found in Mr. Hirsch, that causes symptoms, chest pain, shortness of breath, or passing out or syncope, requires surgical intervention.
He's had 4 bypasses, so they couldn't cut him down the chest again. They had to find another way.
So now you have a nice active guy with significant lung disease who's already had his chest opened and who has blockage in his neck arteries. These are the things we look at to evaluate a patient for higher risk. And we determined that Mr. Hirsch definitely was at much higher risk for classical surgery, and that's where we brought up the idea of transcutaneous aortic valve replacement, or the abbreviation TAVR.
We realize that this is going to be something that's going to be important to offer folks in Dayton, Ohio. So having that in mind, seeing a patient population that's going to need this procedure in ever-growing numbers, it looked like a very logical thing for us to get involved in.
The beauty of the procedure is that the team can get together, do its particular tasks, and we can take care of the patient without opening his chest.
My favorite role is to coordinate the patients and help move them through the process as efficiently and quickly as possible.
Lisa called us and she said, well, we've got the date set for October the 9th, come in the hospital, and surgery's the 10th.
Knowing that he'd be the first one, that was a little scary, but after meeting with all the doctors, we got to meet with almost every one of them before the procedure, and that really eased my mind.
Lisa showed us what it was going to be, It was going to be a little thing going up the balloon, and they was going to drop it where the aorta valve was. And then it was supposed to take off, like this. And she said, boy, when it did, she had tears down her eyes because it went in promptly.
He just did remarkable. Was awake and off the breathing machine by the time he got back to the unit, and never missed a beat.
When he first came out of surgery, I thought they did knock it out of the park. I mean, it was just amazing to see the difference.
You hope for that always, but I was actually impressed that he did feel quite a bit better almost immediately. It was gratifying, I have to say, to see that quicker response. And especially a lot of folks, when they get the valve done surgically, initially the first day or so, they're uncomfortable from the operation. They've just had a major surgery, so they're just trying to recover. So you usually don't get that rapid an improvement, that feedback, where someone can get out of bed and the next day start walking around and they're feeling better after having replaced the valve. It's impressive.
I had no chest discovery after it was done, and I had no pain, and I felt better. In a couple of days, my energy was coming back. Yeah.
I think it's helped him get some of his quality of life back. Not being so tired and run down and wanting to do things again.
I think being the first isn't as important as doing it right. I think it's an important tool in our arsenal for managing people with heart disease. There's going to be a growing population of folks with aortic stenosis. It's going to be an increasing problem with people with increasing illnesses that complicate surgical approaches. So having this option available for folks, I think, that's what's really important, I think. And we wanted to get it done and get it started so we'd get some experience and be able to serve the people of Dayton and the greater Dayton community.
We don't have to go back and see the Dr. Broderick till we come back from Florida. April.
Everybody's released me. Heart doctor, surgeon, they've all released me. So somebody, the good Lord wants me here. I have no what. And she wants me, yes.
After 60 years, you know.
60 years.
In February 19th. And they said it would never work.
Well, the nice part about it, I think I'm going to live to see it.
You probably will.